Hello children, we are going to discuss uterine fibroid today. Now first of all, what is uterine fibroid called? बराबर. तो uterine fibroid मतलब गर्भाशयની ગાંઠ. Uterus, it is related something to the uterus. So uterus એટલે ગર્ભાશય, fibroid એટલે ગાંઠ. આપણે બહુ બધા પેશન્ટોમાં સાંભળીએ છીએ ગર્ભાશયમાં ગાંઠ હોય છે, ગર્ભાશયમાં ગાંઠ છે. So what is that? It is uterine fibroid. It is one of the most common conditions, most common disease conditions seen in females, especially during premenopausal time. Okay. Now for this, we have to first learn the anatomy and physiology about uterus as well as anatomy and physiology regarding the fibroid. So first of all, what about uterus? પહેલાં આપણે ફાઇબ્રોઇડ પર જતા પહેલાં let us discuss something related to the uterus. This fibroid is also called benign tumor. It is also called myoma. Now uterus is a pyriform muscular organ which is situated in the pelvis, where the bladder is in the front and the rectum is at the behind. Uterus is a pyriform organ situated in the pelvis with bladder in the front and rectum at behind. It measures about 8 centimeters long and 5 centimeters wide. It is 8 centimeters long and 5 centimeters wide, especially the width is measured at the fundus. The walls are about 1.25 centimeters thick and the weight is about 50 to 80 grams. This is the normal anatomy of the uterus. The uterus from outside to inside is divided into 3 layers. The first layer, the outermost layer, is called the perimetrium, the middle layer is called the mesometrium, and the innermost layer is called the endometrium. Okay, I'm repeating. The uterus is divided into 3 layers. The perimetrium means the most outside layer. The middle layer is called the mesometrium and the most innermost layer is called the endometrium. So this is all about the uterus. Now we are discussing something related to the fibroid. The word fibroid. Fibroid એટલે ગાંઠ. બરાબર? હવે આ ગાંઠ શું છે? આ ગાંઠ છે ને, it is a circumscribed tumor. It is a benign tumor. Fibroids are benign tumors. It is a circumscribed मतलब गोल, circular, covered. બરાબર? એક જગ્યા પર located હોય તે. It is a circumscribed tumor with a false capsule which fixes itself to the myometrium. Got it? It is a circumscribed tumor with a false capsule which fixes itself to the myometrium. Now myometrium is what? As I told you, perimetrium, myometrium and the endometrium. Okay. The blood supply is such that the central portion of the tumor receives the least amount of blood supply. So the degeneration starts most commonly in the center. Whenever there is a tumor or whenever there is a fibroid, the center portion receives the least amount of blood supply. But calcification starts in the outermost layer, the periphery of the tumor. This is something about the tumor. Now, the fibroids are most commonly found in the body of the uterus than the cervix of the uterus. I'm repeating. Fibroids are found mostly in the body of the uterus than the cervix of the uterus. Okay. You can say the body usually, in the body, it is more than 70% incidences. And in cervical region, it is only 5 to 10% or even less than that. The body of the uterus normally has multiple fibroids. બરાબર? એટલે એક તો પહેલી વાત યુટ્રસની અંદર ફાઇબ્રોઇડ ક્યાં જોવા મળે તો કે બોડીમાં વધારે જોવા, ધ બોડી પાર્ટ ઓફ ધ યુટ્રસ, નોટ ઇન ધ સર્વાઇકલ પાર્ટ. સેકન્ડ another important symptom is there are always multiple fibroids in the fundus or in the body of the uterus, and जो cervical जो fibroid હોય તો normally એ એક જ હોય, single જ હોય. Got it? So this is something related to the basic understanding of what is uterus, where it is situated. Just a revision and something related to the fibroid. Now, one more important, another information. All the fibroids are known as estrogen dependent tumors. The other name of the fibroid is estrogen dependent tumors. Now you have to recollect, you have to ask yourself, or you have to think કે estrogen ક્યારે બોડીમાં વધારે હોય. What is the age when there is estrogen more in the body? You see the tumor developing fast. Estrogen, the maximum growth of estrogen or the maximum growth of a fibroid occurs during the childbearing age. કેમ? કારણ કે એ ટાઈમ પર ઇસ્ટ્રોજનનું સર્ક્યુલેશન ક્યાં તો ઇસ્ટ્રોજન બોડીમાં સૌથી વધારે હોય. It grows, second incidence, it grows more during pregnancy. I'm repeating, childbearing એજમાં વધારે હોય, પ્રેગ્નન્સીમાં ઇસ્ટ્રોજન વધારે હોય, એટલે જો ફાઇબ્રોઇડ હોય તો એ લોકો ગ્રો કરે. થર્ડ, they do not occur before menarche. Yes, and they cease or the growth ceases after menopause. So अगर कोई मेनोपॉजल लेडी आती है और उसके अंदर अगर फाइब्रॉइड डिटेक्ट होता है तो उसको सर्जरी नहीं एडवाइस करेंगे. If it is not so much, if the patient is not suffering too much, you should not advise her to go for any surgery, because fibroids never occur or they never develop after menopause. मेनोपॉज के बाद इस्ट्रोजन कम हो जाता है, तो ये इस्ट्रोजन की वजह से ही ग्रो करता ट्यूमर है, तो वो ग्रेजुअली श्रिंक हो जाएगा. जहाँ जहाँ ये फाइब्रॉइड होता है, बराबर, इन एनी पार्ट ऑफ द मायोमेट्रियम, वेर एवर यू सी द राइज ऑफ अ फाइब्रॉइड, दैट पोर्शन हैज़ ऑलवेज बीन फाउंड आउट कि उसके अंदर ईस्ट्रोजन रिसेप्टर्स ज़्यादा पड़े हुए हैं. The layer of the uterus where fibroid grows, it shows more estrogen receptors than the adjacent myometrium. Okay, and again these fibroids are more seen during in the persons using OC pills. It is related to an ovulation. OC pills users के अंदर fibroids की कंडीशंस तुमको ज़्यादा देखने को मिलेगी. सो किस किस को फाइब्रॉइड हो सकता है? पहली बात, जब लेडी के लाइफ में ईस्ट्रोजन सबसे ज़्यादा होता है ड्यूरिंग द रिप्रोडक्टिव एज, ड्यूरिंग द चाइल्ड बेरिंग एज, बराबर. उसके बाद इट ग्रोज मोर ड्यूरिंग प्रेगनेंसी. उसके बाद इट इज़ नेवर सीन बिफोर मेनार्की एंड इट इज़ नेवर सीन आफ्टर मेनोपॉज. नेक्स्ट, जिसके अंदर ओसी पिल्स का यूज़ सबसे ज़्यादा है, उसके अंदर आपको फाइब्रॉइड देखने को मिलेगा. नेक्स्ट, इट इज़ मोर कॉमनली सीन इन नलीपैरस वुमन और वन चाइल्ड इनफर्टिलिटी फीमेल्स, especially between the age of 35 to 45. It is commonly seen in nulliparous women and one child infertility females, that is between the age of 35 to 45. एक बार बच्चा हुआ है फिर बच्चा नहीं हुआ है, या फिर जिसको बच्चे नहीं होते उनके अंदर आपको फाइब्रॉइड ज़्यादा देखने को मिलेंगे. सो दीज आर द कंडीशंस वेयर यू सी फाइब्रॉइड इन अ पेशेंट. सो नाउ वी विल कंटिन्यू with what are the different types of fibroids. Depending upon the location where the fibroid is lying, it is given names and it is understood. Okay.